Make sure this one is still. Press before. It's very important. Faraja.
That's good. That's enough. Now we can have the bite.
That's enough.
Now.
It is senior to cut a bite.
lazima watoke.
It's okay because you have one power.
Ni mzito hizi. Bas.
Beautiful. The picture. You have the picture.
That's nice. Beautiful. Fantastic. That's good. Yeah.
Perfect.
Thank you. Are we good?
Yes.
Yeah.
Are we good?
Yes.
The fact that in our penal institutions or prisons, we have various categories of people with various medical conditions. We are aware of this fact, and routinely, and is our nature and culture and traditions of prisons, those who have got health or medical challenges, normally we isolate them. And as much as now we have the COVID-19 scourge, we may not need any other arrangements for them because already they are isolated. Such that should a situation be, unfortunately, where we may have any infiltration of infections or infection of COVID-19 virus, they will be safe in where they are isolated. Equally, the aged are also being taken care for routinely. They have their own accommodation. What of the children? Of course, we accommodate the children for between age 1 and age 4. They're equally well catered for. They are staying apart from their mothers, and we have officers who are trained specifically to take care of them. And we are giving them a special attention that this age bracket of children are supposed to get. We give them the diapers, we give them food, the ration that is supplemented, that is enriched, that would facilitate their healthy growth. And occasionally, for those who are still breastfeeding, quality moment is given unto them to allow their mothers to breastfeed.
And finally,
That partners with Kenya Prison Service for over 20 years. Today we are here to flag off a support with sanitary toiletries, because basically the lockdown has made it impossible for us to go to the prisons that we work with and to be able to support. And because of wanting to observe sanitation, we are providing soap today. Next week we shall provide toilet papers and other items that are required. This is because the Commissioner General requested us to be able to support in this, so that the inmates, even the officers that are in the stations, can be able to observe sanitation. We have done many other in partnership with Prison Service. We have done very many other projects, but this is what is important. So we have decided to get all the funds we can be able to get to fight this in the prisons of Kenya.
Take this opportunity to thank and acknowledge the support of Faraja to Kenya Prison Service. As I say that, I also want to acknowledge the very fact that we have walked the journey of partnership with Faraja from 1999. But this is a landmark because Faraja has teamed up with Kenya Prison Services to ensure that we enable our inmates to observe the basic hygiene during this trying moment of COVID-19. While saying that, I want it to be, I want it to come out clearly that the onslaught against COVID-19 cannot be singularly fought. It requires a multi-sectoral approach, both state and non-state. And that's why Faraja has responded to our request that they give us support, that they supplement the efforts of the government towards ensuring that our inmates who for now may not be getting support from their relatives and friends because of the lockdown. But I want to assure everybody that as a service, we are trying everything that we can to ensure that we maintain the highest hygienic standards in our prison facility. Besides that, I also want to urge all and everybody that henceforth the guidelines that have been given by the Ministry of Health towards ensuring that we contain COVID-19 spread should now henceforth be a culture. It should be a national culture for the citizens of this country. The basic issues like washing hands are never luxuries. It should be a culture that is embedded nationally henceforth, and hopefully when we go through this trying time, those basics, we must embed them as a natural culture. Washing hands, keeping distances, and all other directives and guidelines that have been given me by Ministry of Health. But I want to thank Faraja for the support, that timely support that you have given us. Very, very grateful. The donations that that have been extended to us are going to reach all the regions and all the institutions that, penal institutions that we have spread all over the country. Thank you.